Just hit the button when you is it pulled up?
Yeah, I hit the arrow, right? Hi, everybody. How's it going today?
Hello.
We're going to be live here in a couple of minutes with the Woof, Woof, Meow, Meow Vet Advice podcast. We're pretty excited.
Triangle thing.
Okay.
Yep.
Thanks for your help, Kent.
You got it.
We're here at 216 The Net. Super excited to be here. And we have a cool guest today. He's got a lot of good stuff to tell us, too. So that's coming up here in just a moment.
You hear me okay?
Let's see. Speak, Jim, speak.
1, 2, 3, 4, 5.
I think it's all right.
Okay. All right.
Okay. Okay, so 2-minute warning, everybody. Turkey, I don't know how that jingle bell collar is going to work. I think you might have to put after we show her off, you'll have to put a little collar down, poor baby.
Yeah, I'll just hold you, Turkey.
There. Oh,
Yes,
Daddy.
Turkey. I'll go to her.
That's how she wants it, Daddy.
Good,
Oh.
Turkey.
What's with the little size? Does your tummy hurt? Look like you're having a rough day.
I just don't want to be on the air.
She does.
Mhm. Over there, Turkey.
You just wish you had a crown on today?
Yeah.
Of course. My little baby Chorky. Did a good girl. Okay, 1.5 minutes.
All right.
Get all my junk off of here. Almost ready.
All right. I could do like Will Ferrell and just start screaming like.
We stayed up a long time watching that last night, George and I. It was fun. It
Oh,
was
you
hilarious.
didn't?
This last Saturday Night Live.
Oh yeah.
Yeah. He's so funny.
Yeah.
Yep. Okay, so we've got about 45.
All right.
And then we'll go. Are you going to shut the door? Or... Okay. Thanks for helping us today.
Yeah, thanks, Kim.
Yeah, we appreciate it. Almost 30 seconds. Okay. You got everything?
I'm ready.
All right.
Got the turkey.
Right.
All right.
Thank you. See you later. In 10.
Okay.
Hi, everybody. Welcome to the Woof Woof Meow Meow Vet Advice Podcast. I'm Kristen Carlson, here with Dr. Jim Carlson, holistic veterinarian and owner of Riverside Animal Clinic and Holistic Center of McHenry, Illinois. Dr. Carlson's work can be seen on PetMed MD, Pet Coach, division of Petco, NBC News. And this week he appears in a new article for bestlife.com. That article was about cats and some of the unusual things about cats. One of the things you talked about was their incredible sense of smell, which is so much better than ours.
No, they're so sensitive, and it's a really fun article because we don't talk about cat behavior that much, but it is a big topic, especially you know, on TV and things like that with the cat behavior shows and everything. So it's becoming more popular.
Yeah. Well, the article you were in there, and Jackson Galaxy, the cat guy,
Yeah,
the cat master, he was in there many, many times as well. So
Yeah.
I thought that was kind of cool.
it's
You know,
very cool.
yeah.
To be associated with them. Yeah.
At least you got in the same article as Jackson Galaxy,
I
right?
know.
All right. Today we're going to talk about a new video we shot on Monday that showed a little dachshund who was carried into the clinic, and he received acupuncture from Dr. Carlson. During the treatment, the dog named Daisy was actually able to walk. The video quickly had about 1,500 views locally around here, and we want to talk about the success of acupuncture treatments at Riverside Animal Clinic and Holistic Center. So that video is actually on our Facebook page if you'd like to take a look at it. And also today, we'll be discussing bladder stones and our new video on the tools that you need to collect urine at home, and that's with our beloved Nancy Worley, who is our technician. First today, though, we have, we're going to talk about a topic that sparks a lot of questions to the veterinarian, and then pet owners seem to go to the lay staff, especially up at the cashier station, to see if pet insurance is really worth it. That's their big question. Pet insurance companies are ubiquitous, so we've decided to speak with a company today that we frequently worked with and trust, and that's Trupanion Pet Insurance. On the phone today, we have Mary Roethlisberger. She's the Vice President of Analytics for Trupanion. And hi, Mary. How are you doing?
Hi, Mary.
I'm good. How are you, Kristen?
Oh, we're
Dr.
good.
Carlson?
We're good. Thank
Thanks
you.
for having me today.
Oh,
Yeah.
yeah, it's awesome.
You're welcome.
So tell me a little bit about why Trupanion feels it's important for pet owners to get medical insurance for their pets.
Right. Thanks for the question. So to me, really what it comes down to is pet owners, it's really important for them to think about how they might budget for their pet's medical costs. And oftentimes those medical costs are very unexpected, right? And so how do you budget for something that is unexpected? And that is very difficult. And so that's, where Trupanion fits in and where I come in, where I on the analytics team here and studying the data that we see behind our insurance. And so in fact, we actually have over or almost 500,000 pets insured now.
Wow.
And, this team of people, trying to figure out what is the most likely to be unexpected and how can we help pet owners budget for that? So that to me is really why it's important, is because it's really tough for a pet owner to know whether their pet will be, lucky or unlucky.
Yeah, exactly.
Yeah,
Exactly. And it's
for
something we tell people all the time, it's like just either you got to dedicate some serious savings to your pet for an emergency, or you could try to go with a pet insurance that has, some kind of emergency policy to it for sure. Because these specialty centers, are paid a lot of money for a reason. They have extra education. They're open at night. There's so many things going on. So they are expensive to have to go to those places. What barriers might pet owners encounter when they're looking at insurance?
Oh, yeah, great question. To me, when you're thinking about, looking at insurance, I really think, talking to your veterinarian is a really good place to start, right? So like you said, cost of care, especially at an emergency hospital, can be higher. The level of medicine that practice there is really high. And so veterinarians are the ones who, are often, having that financial conversation with pet owners. Mm-hmm. And they also, tend to be the people who also have the most touch points with insurance. And so, that's like Dr. Carlson, I believe that, that's the right person to talk to, when thinking about, what barriers might be, might exist for insurance. Really, insurance is available. So we're located here in Seattle, Washington, and have, cover pets all across the U.S. and Canada also. Oh, and really? So, in terms of location, it's available all across the country.
Okay. What's the average cost for insuring a dog or cat?
Yeah. Yes, of course. So with Trupanion, we see the average cost. Really, the price depends on a few different things. One being geography. So you all are located out, you said, in Illinois. And so that's one thing we look at. We also look at the species differently because they have very different health risks. We look at pricing by breed, pricing by age of the pet. So on average, we see premium costs about $60 for a dog and about $40 a cat, with a big range, depending on, like you said, what kind of pet you have, how old they are, and where you live.
Oh, okay. The common conditions that cats and dogs face, are very different, and some are more expensive to treat than others. So in their lifetime, what are the main things people have to be seen for, or have to take their animals to be seen for?
Oh, sure. Yeah, we see, we actually have, over, thousands of conditions that we see pets claiming for.
Wow.
What are the most common, like you, I know. Yeah. Like you said, Kristen, the most common does vary quite a bit from cats versus dogs. Like, different species, I think of them totally differently. So starting off with cats, the most common conditions that we're seeing are things like vomiting and diarrhea. We see, kitties coming in for masses, ear infections. The other thing that we see as being really common in kitties would be things related to their kidney health. So in younger cats, that turns up as, urinary tract infections, just like humans get, or urinary obstructions. Mm-hmm. And as cats get older, we, unfortunately start seeing renal failure and kidney disease.
Yeah. Yeah. Yeah, those do all come with a cost. What is the average cost of a claim for emergencies?
For all emergencies. So if we think of kidney disease, that would be, often treated, at an emergency hospital or by a specialist. Would be, maybe around on average $1,500 a treatment. Urinary obstruction, I would imagine you also see some cases of those. We see, on average, those cost about $2,800 to treat. So they're, they can be pretty severe.
Yeah, they can be, fatal. You can't wait too long on something like that.
That's for sure, because there's a lot of electrolyte disturbances. You have to monitor the patient. It could be several days.
Yeah, a lot in surgery too. Can you tell me about any unusual claims that you've covered that stand out among the others?
Mm-hmm.
Oh, sure. So, being the holiday season, we always are looking back at some of the unusual holiday claims we've had. So one that I found I thought would be fun for you is that we found a mixed breed puppy in Washington a few years back. His name was Winston, and he ate a Christmas ornament. It ended up costing, that's great. There's an example of an emergency claim. It ended up, his bill at the vet was over $5,000, and Trupanion ended up covering our 90%, which is $4,500 on
Seriously?
That's incredible.
Wow. That's incredible. So if you think about it, the average, that's a $5,000 bill that people just aren't expecting at Christmas. And if you don't have pet insurance, you might have to make some decisions.
Yeah. It's
that
one
are
of those
unpleasant
emergencies that come up that it's wow, thank God you had protection.
Yeah, totally. And do you have any others that you'd like to share? Because these are good stories.
Oh, sure. Yeah. Oh, I've got hundreds up on my computer now. But the other one I thought of that, since we were talking about cat conditions too, the other one I thought of is what we see in kitties is tinsel ingestion around the holidays. So again, emergency type visits. One I'm looking at here is for it was a short hair in American Shorthair in Maryland. Her name was Gracie, and she was also pretty young and ended up eating some tinsel, and it cost almost $2,000 to get the tinsel removed.
Wow. That just happened to us. It happened with Curly Ribbon, though.
Really?
Yeah. Our own cat did it.
Our own cat did that behind our back. He's our clinic cat now. Yeah. So he had to have surgery too, but thank heavens it was free. Free for us, but not for everybody else. And we get that is huge. Mary Roethlisberger, thank you so much for joining us today. And Vice President of Analytics for Trupanion. And you've been a great guest. That was very intriguing and very interesting. Thank you so much.
Thanks for having me.
All right. Take care.
Thanks, Mary.
Bye-bye.
Bye.
All right. Well, that was kind of fun.
Yeah.
Boy, you just don't think about some of these things and how much they do add up to.
Yeah. Insurance is so important because you kind of look at it and say, well, if it's there when you need it. You got to have something there because how can you predict an emergency? You just can't.
You can't predict the tinsel. It happened to us, and I know better than to leave anything like that out.
I don't know.
Of course.
A piece in there,
With 8 cats in the house. So, they're not all in the house, but it's close.
Right.
Yeah. So
you never know,
All right. Well, moving on today, a lot of people around the area have been fascinated by the video showing Dr. Carlson's patient during an acupuncture session. This adorable little dachshund, Daisy, has had some issues in the past, and she was carried into the office. She couldn't walk, so Daisy had acupuncture on Monday. During the session, she started to change. So why don't you tell us a little bit about what transpired from the time you saw Daisy until she went through her acupuncture and started to walk again?
They had brought Daisy in, and she during her physical exam wasn't able to stand. She would cross over her legs
like this way.
Okay. Her back legs would cross over. She would fall down. She wasn't able to really right herself. She had a bout of this months ago, and we did some acupuncture and helped her out. And she had got bumped, and her spine started to act up again. And so she was acting somewhat painful. Mm-hmm. A lot of times with spine injuries, they can start to have numbness in the feet and discomfort and things.
She was also, I loaded her room, and she was just seriously anxious about whatever was happening to her. She knew things weren't right.
That's for sure. And like any anything, if your back end isn't working, then all of a sudden things get, pretty worrisome for a pet, especially because there are 4 on the floor, and when they can only have 2, that's really a problem for them.
Yeah. It's also a problem for bathroom habits. So
Oh, yeah.
that also can be very uncomfortable for your pet if something like this should ever occur. So it's just something to think about and something you guys should know. So what else happened then? You go and how do you decide where to place the needles in her back?
Well, there's specific acupoints that are related to intervertebral disc problems and spondylosis. And so I've learned through the years, because I've been an acupuncturist since 2010, so about 9 years. It's by feel, as you practice it long enough, you develop your own philosophy about where you want to put the points. But I use specific acupoints and then determine if by feel that is the right place to set the needle.
Oh, okay.
So it's more by experience.
From what I understand, you're looking for kind of a little divot, right?
A divot or depression or pressure or sensitivity. My fingers are sensitive enough. It almost feels like a little electrical activity. The acupuncturist, Dr. Shea down at the Chi Institute, had mentioned that a few people have that ability, can feel it.
Oh, all right. You're a witch doctor then.
Well, no.
That's what we call woo-woo.
Yeah.
Woo-woo that's what's known as woo-woo when you've got it. You
The
just
woo-woo
got that
part,
little holistic bent there. So how does this work exactly? Because first of all, does it hurt?
They feel, and I've had acupuncture, so I can feel the pressure of the tip of the needle going in, but after that, it feels like a light numbness. You can tell something's there, but it doesn't hurt.
Oh, yeah. Okay. All right. And then, so you put all these, I don't know, you might have had 10 needles in or so.
Yeah.
So you put them all in. What's the woo that happens then?
Well, the idea is that the needle is stimulating, from a Chinese medicine standpoint, it's stimulating qi and energy movement. But from a more traditional standpoint, we're stimulating neurohormones, so endorphins. And by setting the needles in that spot, you're sending endorphins to that area.
Okay.
And like Daisy, she got immediate relief from that.
Yeah.
Yeah.
Yeah. She was really cute. She's getting a little older now.
Yeah.
And as these like long-backed dogs become a little bit older, you're going to start seeing more maintenance. Is that correct?
Yeah, that's for sure. And it's sort of like my chiropractor said, well, you can injure yourself and then just come in, but it's harder on you to wait. So after the injury, it's better to do maintenance. And so you go in every so often after the injury and have a tune-up.
Yeah.
So the average tune-up maybe 3 or 4 times a year to have just 5 to 10 acu needles put into place. And
you have a lot of dogs. I mean, this isn't the first time we've had so many dogs who've been carried in, able to walk out the door after acupuncture. Just there's a lot of them, but we're still seeing these dogs 10 years later because we've owned Riverside for 10 years, and some of them happened right as we bought the clinic. So these dogs are 10 or older, and we're still seeing them on a maintenance plan. And the owner kind of gets grooved into it. They kind of understand, okay, I see you're moving a little bit differently, or I saw her jump off the couch and she's not supposed to. I think I'm just going to take it in and get on it before. We have another owner, Gracie is the pet's name, and she works for a chiropractor. She told me that she can tell when Gracie's tail curls that something's going to go wrong. So she comes in right away, gets acupuncture done, maybe a little cold laser therapy for some of these animals too.
Yeah. And Miss Stella's another one, boxer, comes in every so often. The owners get, like you said, in tune to what's going on, and they can tell. And as you bond with your pet,
to do the maintenance than it is to get into a crisis again.
Yeah.
Bella the dachshund is on our website, riversideanimalclinic.net. She was your first one in McHenry.
Yeah.
And she still comes in. She's so cute.
Yeah.
And, after they were going on a trip, they're like, here, take her, figure it out if you can. If not, the surgery was going to be really expensive. And they're like, I don't know. And then you did it. And she was walking by the time they got back from their trip. And she is really doing really, really well.
Yeah, she comes in for tune-ups once in a while.
Once in a while. Not even that often.
No.
I mean, she might go 2 or 3 years without a tune-up.
Yeah.
Yeah. It's pretty impressive.
It is.
How old is this method and how was it created?
The, from the oldest relics date back to about almost 10,000 years ago. And it looked like it was actually a mummified person. They'd found some marks on the person, and then there was some stone-like objects that had points. But probably 2,000 to 3,000 years ago, where it was officially documented in China, and then from there, really just recently in the United States, just as early as maybe the late 60s, early 70s. It's actually, surprisingly, during the Nixon administration, they were visiting China, and one of his staff had gotten really sick over there. And it was too difficult for them to fly back to the States. And they said, well, why don't you let one of our doctors work on him? And they did acupuncture, and he got immediately better. And of course, that was kind of a controversial time between the countries. And they said, well, we can't let China have an advantage over us. So we started.
Do you need to use other methods with acupuncture?
A lot of times you can use herbs.
Okay. Tell us about that.
And herbal remedies complement the acupuncture because they're working on specific meridians as well. So it's like between the acupuncture sessions, you may go, every few days to every few weeks. The herbs are there to give a little bit of it's almost like a little dose of acupuncture every day. And it's complementing the pattern of disease that got them to that point where they needed the acupuncture. So it's a nice complement.
And the acupuncture follows the meridians. So if you were to think of your own body or an animal's body that had lines, like rivers of energy that ran down the length of the animal, right? Am I describing it correctly?
Yeah.
That was, and you can Google it. You can see images of meridians. They're really cool. So you're working on those channels of energy that are running through a dog's or cat's system.
That's right. There's many channels. Each channel, there's about 12 channels, but each channel has many points, could be up to 30 to 40 points. So you could have literally, several hundred different points. Some are more common than others, and some are more traditional. The acupuncture actually started many years ago, 2,000 to 3,000 years ago, on horses and people, because horses were used a lot for transportation. I
think people forget that horses built cities and horses fought wars and horses did so many things. Yeah. And they're athletes. They require care just like everybody else.
That's for sure. Dogs and cats came on later, transposed from humans and horses.
Oh, okay. Yeah. All right. Some specific breeds, like Daisy is a dachshund, and there are some specific breeds with problems that can be helped, not just pain, but sinus, other issues.
You can use it for literally any disease process, but more commonly we'll see muscle and skeletal problems. So the dachshund is well represented, the Pekingese with their long torso. The bully breeds, the short-coated breeds, a lot of muscle, tend to pull muscle easily. So the bulldogs are well represented.
And you've done it on, I just saw the video. It's on our YouTube channel. So Riverside Animal Clinic YouTube channel is called Riverside McHenry on YouTube. And you did it in the cat's face. Yeah.
That works really well for sinus congestion. You use little hand needles, but obviously every cat's not the best candidate for that, but that particular cat worked really well.
Yeah. I mean, you had a lot of success with cats. It's surprising. You think any one of them would be like, forget this.
Yeah.
But you've done pretty well with cats, I think. I mean, over the years.
Especially Megacolon is one of those. Our friends came over that time from Ohio. And
Yep. Yeah. And I mean, it does work. So it does work for the cat. So if you're thinking my cat is never going to sit still for that, sometimes they will.
Yeah, any animal can benefit. Rabbits
Mhm.
to giraffes.
Yeah. All right. Well, that's good. All right. So, shifting gears a little bit today, we're going to talk a little bit about bladder stones. Preventive diets are common in veterinary medicine. One of the most common diets to keep a medical problem at bay is the diet that treats bladder stones. These are a really serious condition. My only time I've had out of the dozens upon dozens of animals that we have owned, the only one to ever have a problem was Chorky.
Yeah.
She's sitting on the floor right here. And she came to us, got out of her transport from Kentucky. She was with Starfish Animal Rescue, and we adopted her. Took her out, and she just started going blood. It was really, really bad. And you took an egg-sized bladder stone out of this little
Yeah, it was
tiny.
huge.
I mean, at the time, she's chubby now, but at the time, I think she was 4 pounds. And
Yeah.
I'm pretty sure the only thing she ever ate was McDonald's, because she really understands when you pull into a McDonald's or something like that. Diet,
Treat time.
I'm assuming diet is what affected her, because she's never had a problem since she's been with us.
Yeah, the extra energy. I mean, if you think about it, one bite of McDonald's hamburger is about 328 calories, and that's about her maximum calories per day. So all that extra energy, the high ash or filler content in the diet, magnesium, those are other big factors that can contribute to stones. Low back problems, big one. You know, just not
Why
being
is
able to get all the urine
Oh.
evacuated. You know, when they're going to the bathroom.
Okay.
So unfortunately, if a little bit of that turbid urine sits in there, the pH goes up, concentration goes up, and that can lead to crystals as well.
Oh, really? We just wanted to say hi to Phil, Stephanie, and Melinda.
Hey,
Thanks
everyone.
for joining us
Thanks for
today.
joining us. Hi.
We really appreciate that. So as far as the bladder stones are concerned, like, how do these start? And is there a certain breed that's susceptible to them?
Well, they start by either nutritionally or low-grade bladder infections or even liver problems. Probably the most common stone is the struvite stone, which is more either a bacteria can produce the struvites, or the type of urine environment can contribute to the struvites, especially the dogs who can't get all the urine out. If they have
a high pH, a low pH, does that count too?
Definitely. So most struvites have a high pH. And if there's a liver condition, can be a lower pH, in which you would have what they call calcium oxalate crystals.
Okay.
And then sometimes there can be a blend when you send the stone in. It's sort of like a tree trunk. There's different layers that can tell you a lot about how it started and what developed over the course of time.
And the diagnosis of the stone, like when you send that, there's a lab that does this in Minnesota, and they see what's in that stone. That's important to a treatment plan. It
is, because it's going to tell you particularly what the protocol is for long-term to try to prevent it. More traditional approach is managing with pH modifying diet that keeps the pH ideally between 6 and 6.5. And just making sure they're well hydrated. Unfortunately, a lot of dogs might get into bladder issues because of the work schedule for owners. The average dog shouldn't hold their urine probably more than 8 hours.
True. We were all just talking about that the other day.
Yeah.
I mean, they really have to stay home a long time.
Yeah.
When people are gone.
Yeah, when they're pushing 8 hours or more without going or having a place to relieve themselves, like a potty pad or something like that, we're kind of maximizing the threshold for the bladder, and it can lead to cystitis or inflammation.
Okay. All right. What about cats? Do they also get bladder stones? I know the cats get UTI.
They do.
Or urinary tract disease. But do they get bladder stones too?
Well, the literature says that it's about 50-50, but in our practice, I think through the years, we see a lot more male cats than female in terms of the stone problem and blockage. But across the board, cats are well represented for cystitis or feline lower urinary tract disease, which then promotes the crystal formation and then eventually stones.
Okay.
So, yeah.
All right. Are there ingredients in their food that causes part of this problem?
Well, ash, dogs should have no more than 2% ash in their diet and about roughly maybe 1% magnesium. Cats can have a little bit higher ash, and ash is the filler content in the diets.
Mm-hmm.
So cats' dry food can be about 7% with 1% magnesium, and then wet food for cats a little bit lower, 1.5.
What's ash doing in the diet?
Well, ash is there to as a Marcus as a filler. Sometimes it can be preservatives or something like that,
Oh,
which is allowed. A very small percentage in the diet is something that's really not food.
oh, okay. I didn't know that.
Yeah.
Are bladder stones obviously pretty painful? Can they be passed at all?
Very small ones. Cats.
Like how small? Like half a pencil eraser or what?
Well, a dog can probably pass BB sized.
Oh.
And a cat really can't pass anything at all without causing potential obstruction.
Okay. We've had some luck with cold laser
Yeah.
in being able to relax that area, right? Can you explain that?
Yeah, when they have an obstructive type problem and they can't urinate very well, it's uncomfortable. Especially male cats, they get the sphincter becomes spasmodic, and when they're trying to go and it's uncomfortable, it collapses down so they can't go.
Oh.
And laser helps to relieve that, so they can, if they're not obstructed but just tense, then they can go where it doesn't hurt.
Yeah.
But if they're truly blocked, I've had about 20 to 30% success with laser when they've been blocked. It helps to kind of break it up.
Okay.
So they can go.
What dissolves bladder stones? There's some foods that do that you can keep in the practice, but they're not necessarily always going to work, like AD.
Yeah. The wet formulas work really good because you want high moisture content. You obviously want to reduce the concentration of the urine to not really be under 1025, but at the same time, you want them urinating quite a bit. Number two is you want a pH modifying diet.
Okay.
And that's important. Chinese herbs can also, like crystal stone formula, can help to modify the dampness and move the urine out of the bladder.
Oh, okay. All right. And you have some favorite foods would be the Royal Canin SO.
Yeah.
Urinary SO.
I like SO mostly because it accounts for the struvites and oxalates, because sometimes if they're on the struvite for too long, the pH will drop and promote more oxalates.
All right. We have one Hey Doc question today.
Awesome.
And that is, what can I use for my dog's paws in this winter weather?
Best thing, you can, when they come in,
5
you want,
seconds.
okay, you want to have just use a quick wet wipe and then
right.
use something like a bag mop.
Thanks so much.
Thank
See you
you.
guys later.
Yeah.
You want to get your phone?